let's start with, what is rosacea? Rosacea is a chronic inflammatory skin disorder. It waxes and wanes over time, and it causes redness of the face, broken blood vessels or capillaries on the surface of the skin, and papules and pustules, commonly referred to as acne rosacea. In fact, acne rosacea can frequently be confused with acne, and that's important to know because the treatments we generally use for acne can oftentimes worsen rosacea. Unfortunately, we do not know the underlying cause of rosacea. This means we don't have a cure for rosacea, although we can control and manage symptoms through various modalities of treatments. When I talk about the treatments of rosacea, I like to break it into 3 buckets. The first bucket is general measures that will help all the various symptoms of rosacea, and the second bucket is treating erythematous telangiectatic rosacea, which is a big fancy word for the redness and the broken blood vessels. And then the third bucket is the treatment of the acne rosacea, the papules and pustules. General measures, the most important thing is avoiding the triggers that cause rosacea flares. If we can avoid the triggers and avoid the flares, we can have less downstream redness and acne. For my rosacea patients, if they make only one change, what I would like them to do is use a daily, broad-spectrum, mineral-based sunscreen every day. SPF of at least 30 for indoors and 50 or above for outdoor activities. For our second bucket of treatment, we'll talk about the acne rosacea or the papules and pustules. So these are going to be best treated with either topical or oral antimicrobials and anti-inflammatory medicines like azelaic acid. So the mainstay of treatment for acne rosacea is actually metronidazole or Metrogel. This is a topical antimicrobial, and you can get this with a prescription from your provider. Also, azelaic acid, which is an anti-inflammatory, is another great option for rosacea patients with acne. Again, this will require a prescription through your provider, and some pharmacies can compound these together into one cream. The last bucket of therapy, and that's the erythematous telangiectatic rosacea, again, that's the redness and broken blood vessels, is really the most stubborn and hardest to treat of the different rosacea subtypes. But really the best bang for your buck for this type of rosacea is going to be light-based therapy, including IPL or BBL. So that's intense pulse light or broadband light. Here at Aesthera, we offer the Halo BBL device. This is really a game changer for patients with those broken blood vessels and redness. Patients who've had this therapy are far more satisfied than patients who've done topical therapies alone. In conclusion, I think it's important to remember that rosacea is going to require a holistic approach. We can't cure it, but we can manage it, and we can really get good results with a combination of therapies.